Madison is here with her husband Kyle, and I want everyone at home to understand how brave Madison's being just here today in this moment, because we feel your pain. But going to see Dr. Dow, going to see Dr. Lee, did that help you in any way?
I think it helps. I think that it's hard to be this vulnerable. It's hard to have this insecurity that you share with the world. So,
but if I may, before we get to Dr. Lee and Dr. Dow, I want to be clear that yes, people here are recognizing the rash, okay? But we're seeing you.
Yeah.
You know, the only thing I see right now is you. And Dr. Lee, really quickly with you first, how often do people actually come to you as a dermatologist complaining of situations like this?
You know, we see this a lot in dermatology. There's a big overlap of dermatology and psychology, really, because we deal with the skin, and we have to deal with that and have to find a way to make it better.
And did the two of you, after both evaluating Madison, agree on the diagnosis?
Yeah, I think we did, and we realized that, you know, this is a huge step therapeutically. So to have this specific phobia, which then turned into social anxiety disorder, for somebody to have social anxiety disorder, to be sitting here in front of all of you and the millions of people watching, good job, Madison. This is such a huge step for you. So good work.
So Madison, of course, is sitting here, and I'm sure you're thinking, well, this is all great, and I bravely come on this show with my husband, but what do I do, right? Isn't that kind of what you're thinking now? How do I overcome this? What can be done?
So I think exposure therapy, which is a part of cognitive behavioral therapy, we talked about the sort of baby steps, which is layman's terms for graded exposure therapy. You put yourself in situations, and your experience starts to change the way you think about things. And when you change the way you think about things, you start to change the way you feel. So our experiences, our thoughts, our feelings are all interconnected. But like you said, Madison, you are the person who has the power to either choose those experiences every day or not. And every time you wear a turtleneck or a scarf, you're actually making the situation worse by keeping it such a secret.
I think we're going to have to make Madison a regular talk show host with us. And then she does this every day.
Exposure therapy.
Well, do you realize that in some ways you will probably maybe never be in as vulnerable of a spot as you are right now? This show is viewed by millions of people. It's viewed across the world. And yet I think everyone here, we are just impressed with you. Are we not? I mean, is there ever going to be another moment, whether you're giving a speech or whatever, where you're going to have millions of people? I mean, this isn't really graded exposure. This is hardcore exposure, and you're shining.
this is big. It's big, and I'm blessed because I have a lot of support in my life.
You're from Colorado, and we actually, based on Dr. Dow's evaluation, we're going to send you back to Denver for a consultation with Cognitive Behavior Therapy Associates of Denver. If they agree with Dr. Dow's assessment, they're going to provide you with 3 months of therapy for free.
Woo!
So, thank you both for bravely coming on. Dr. Lee, thank you so very much.